given the response to the nationwide opioid abuse epidemic, there is a lot of attention at the state and federal levels that goes directly to the primary care provider. And of course, the major report from the federal government revolved around the CDC guidelines for the prescribing of opioids for acute pain and in the primary care setting. Well, those guidelines can do a lot to help equip a provider to steel himself or herself in the event that there is someone who looks into how that person practices medicine in the field of pain. And it is in many regards not hard to comply with a number of the recommendations set forth in the CDC document. Where there are areas that the evidence is not strong or the recommendations are inconsistent with what we know to be real practice or recommendations from credible organizations or inconsistencies with the labeling of a particular product, it's easy for an individual to justify deviating, again, if there's appropriate documentation based on the best practices in the field. So all in all, we can see that there is a benefit of additional resources, which is a good thing. Not all of the resources are appropriate in all of the circumstances, but the more that an individual practitioner can pick and choose and refer to and then document in terms of the reasons for making prescribing and other care decisions, that's a good thing. And I think that there's an opportunity to embrace that and see it as a chance to do things better and protect oneself. What we see is that given the intense scrutiny, not just of the regulators or of law enforcement, but also now the insurers and the plaintiff's attorneys on the prescribing of controlled medications, especially opioid medications for pain, that many people are reluctant to prescribe. And unfortunately, that means that many people who need medications and don't have any alternative therapies, having tried everything else out there, are going to go without appropriate treatment. And in the midst of an epidemic that's largely also supported by an illicit supply of things like heroin and counterfeit fentanyl, it can exacerbate the problem. So where there is a lack of balance in the approach by the regulators, or when there is a lack of resources in terms of training and education, and people do not feel adequately equipped to meet their obligations in the safer prescribing of controlled prescription medications, including opioids, then there is going to be an exacerbation not just of pain or anxiety or ADHD or addiction and those medications that are controlled and that people are not willing to prescribe, but also that then there is going to be an exacerbation of the epidemic itself as people seek relief in other areas. And so we're going to have to deal with this in two primary ways. The first, we need to make sure that our policies are moderate, they're based on science and medical practice, and that they reflect what is a true and appropriate scientific approach, medical approach that respects the prescribers and professionals' discretion. All right, but then we also need to make sure that we are equipping these individuals, the practitioners, with the tools so that they can do their job and that they meet the needs so that individuals are not required to go to the streets for treatment. Well, there is something good that has happened, actually, in federal legislation, which is that Congress has said that the federal government has to put together a task force to determine what are the appropriate standards for pain management. And so that hopefully is going to result in a document that recommends that there be coverage for things like chiropractic care or acupuncture or massage therapy, all these types of non-pharmacological treatments, and then ultimately the non-controlled pharmacological treatments should also be included in these recommendations. But we'll also see, I think, a more appropriately put together set of recommendations related to the prescribing of opioids when they are medically necessary for the treatment of pain. And these will include input from a variety of stakeholders, and they will likely be consistent with FDA labeling, be consistent with guidelines that come out from other professional organizations, and reflect the needs of various patients who will be represented on this task force. So we should have a much greater, more moderate, well-balanced, and well-put together, better supported document out there available to primary care providers as well as pain treatment specialists for the treatment of pain, using all the types of resources that are available to practitioners and patients. That's a great thing to look forward to.